Several important developments on the cancer front this morning. A new report says the number of cancer survivors will grow by more than 30% over the next decade. There's also promising news for men with advanced prostate cancer.
Research shows they can live more than a year longer thanks to an older chemotherapy drug. And we're learning of even more findings just released at a medical conference. Our Dr. David Eggers leads the Westside Cancer Center at the University of Southern California, and he is in Los Angeles. Doctor, good morning.
Good morning, Charlie.
What's the new findings, the new approach?
Well, every year, at the end of May, beginning of June, cancer doctors from around the world meet in Chicago to talk about new approaches to cancer and go over the results of the past year. Well, this year was announced a clinical trial where they took people who had metastatic prostate cancer when they prevented or failed after surgery and radiation. And instead of just giving hormonal therapy, which has been the standard for 75 years, they added chemotherapy early instead of later in disease, and they prolonged survival by close to 14 months. A 14 months improvement in survival is dramatic in the treatment of this disease.
Why wasn't chemo used right away like in other cancers?
It's a great question. You know, men historically have not enrolled in clinical trials like women. So prostate cancer is lagging years behind breast cancer in terms of development. This was a drug that was end-stage cancer. It has a lot of side effects, and so until it was proven, people weren't using it early. The trial took about 10 years to get the data, but the data are clear now, and this will be game-changing.
So which men do you think, Dr. Eggers, will benefit?
These are people who either present when the disease is spread outside of the prostate or who have failed treatment with radiation and surgery. So in those cases, we used to just remove testosterone, which Huggins won the Nobel Prize for showing 75 years ago. Now we're going to put chemotherapy in that setting and extend their life and the quality of life.
What else happened at this meeting in terms of treating cancer?
Well, minutes ago in Chicago were announced the results of several trials of drugs that take the brake off the immune system. And by doing that, the body's own immune cells could start to attack diseases like advanced lung cancer and advanced melanoma. And in one of the trials, they actually used that type of therapy before the disease had spread to prevent recurrence, showing some pretty impressive results. So one of the big ways we're going to treat cancer going forward is by unleashing the immune system instead of chemotherapy in some patients.
Really interesting. Dr. David Eggers, thank you so much.